Welcome to today's video, where we will be discussing the early signs of heart valve problems. Every single beat of your heart relies on 4-minute valves operating in flawless synchrony, opening and closing more than 2.5 billion times throughout your life. Despite this, millions of individuals are currently living with damaged heart valves without even being aware of it. The silent progression of early heart valve disease makes it one of the most dangerous conditions in medicine. This is what truly concerns cardiologists. While 2.5% of Americans have heart valve disease, the presence or absence of symptoms does not always reflect the severity of a person's condition. Your heart valve could be significantly impaired while you feel perfectly fine, but your body is in fact sending out urgent warning signals that the majority of people disregard as normal signs of aging, stress, or simply being out of shape. Today, we are unveiling 8 early warning indicators that could genuinely save your life. These are not just random symptoms, they are your cardiovascular system's desperate plea for help before a crisis occurs. Let's now examine the early signs of heart valve problems, starting with the very first one. 1. Heart murmur. The first, and often the most pivotal early indicator, is something that you cannot detect on your own: a heart murmur. When a doctor uses a stethoscope to listen to your heart, they are listening for that characteristic whooshing or swishing noise, which signifies turbulent blood flow across your heart valves. Research from the National Institutes of Health indicates that a significant number of heart valve issues are first discovered through the identification of a murmur during a standard physical exam. This abnormal heart sound is generated when blood moves irregularly through or around the heart valves, which creates that distinct sound. It's important to note that not all heart murmurs signal a problem. Some are entirely benign, particularly in children. However, the American Heart Association stresses that any newly found murmur requires additional assessment, typically through an echocardiogram. This is because a heart murmur can be the earliest detectable evidence of either valve stenosis, narrowing, or valve regurgitation, leaking. Studies have shown that for trained medical professionals, the sensitivity in detecting murmurs can be as high as 70%, with a specificity reaching 98%. The Cleveland Clinic also notes that AI enhanced digital stethoscopes are now capable of identifying 94.1% of valvular heart disease cases, a significant improvement over the 41.2% detected by traditional stethoscopes. 2. Shortness of breath. Our second early warning sign is shortness of breath, an indicator that is far more significant than most people appreciate. This is not simply about feeling breathless after taking the stairs. This is a sign that your cardiovascular system is having difficulty delivering enough oxygen to your body's tissues. According to research in cardiovascular medicine, shortness of breath in the context of heart valve disease arises because malfunctioning valves disrupt the normal circulation of blood through your heart's chambers. When valves fail to open sufficiently or close properly, your heart is forced to work much harder to pump blood. The American Heart Association considers shortness of breath a primary symptom of valve dysfunction. At first, you may only experience breathlessness during strenuous physical exertion. As the valve disease worsens, however, you might find yourself out of breath during everyday activities such as walking to your mailbox or even while lying down flat in bed. Medical research clarifies the mechanism. When heart valves are not working correctly, blood is not moved efficiently between the chambers of your heart. This results in oxygen rich blood not reaching your organs effectively. Your body attempts to compensate for this deficit by prompting you to breathe faster and more deeply. Johns Hopkins Medicine reports that this symptom is especially prevalent in cases of mitral valve disease and aortic valve disease. 3. Fatigue or weakness. The third early indicator is a persistent feeling of fatigue or weakness that seems entirely out of proportion to your level of activity. This is not the tiredness you feel after a long day. It is a profound state of exhaustion that suggests your heart valves are not maintaining adequate blood circulation. Research from leading medical institutions has demonstrated that fatigue in heart valve disease is a result of your organs and muscles not receiving an optimal supply of blood. When your valves do not operate correctly, the efficiency of your heart decreases significantly, much like trying to water a garden with a hose that has a kink in it. The Mayo Clinic and other respected medical centers have documented that patients with valve disease frequently report feeling drained even after minimal physical exertion. Your heart is essentially working overtime to make up for the faulty valve, which leaves very little energy available for your daily tasks. This type of fatigue is different from normal tiredness in several key respects. First, it does not get substantially better with rest. Second, it is often accompanied by a feeling of weakness that seems to originate from deep within your body. Third, activities that were once easy for you become surprisingly difficult and exhausting. The Cleveland Clinic highlights that this specific type of fatigue develops because your body's tissues are being deprived of the oxygen rich blood they need to function at their best. 4. Chest pain or discomfort. The fourth critical warning sign is pain or discomfort in the chest, especially during physical activity. This sensation represents your heart muscle signaling for help as it strains against the resistance created by a diseased valve. But before we proceed with more of this life saving information, if you're new here, welcome to a community that prioritizes your heart health. We are building something meaningful here together. Please be sure to hit the like button and subscribe so that you never miss crucial health updates that could save your life or the life of someone you care about. Your path to heart healthy living begins right now, and we are privileged to be your guides. Oh, and let us know where you are watching from by posting your country in the comments. We enjoy connecting with our global heart health community. Medical research clarifies that chest pain related to valve disease usually happens because your heart muscle is either not receiving enough blood flow or is under excessive strain. This is especially common in cases of aortic stenosis, where the narrowed valve impedes blood from leaving the heart. This chest pain has unique characteristics. According to studies in cardiovascular medicine journals, patients often describe this pain as a pressure, tightness, or a sense of heaviness in the chest, rather than a sharp, stabbing sensation. It typically arises during physical activity when your heart needs to pump more forcefully, but the malfunctioning valve creates a bottleneck. 5. Palpitations or irregular heartbeat. The fifth early warning sign is experiencing heart palpitations or an irregular heartbeat, sensations that your heart is skipping a beat, fluttering, racing, or pounding in your chest. These disturbances in rhythm often indicate that your heart valves are not operating as they should. Research from the National Heart, Lung, and Blood Institute has shown that valve related palpitations are a result of faulty valves creating turbulent blood flow patterns and an increase in pressure within the heart chambers. This can set off abnormal electrical activity, which leads to those unsettling rhythm sensations. The Cleveland Clinic and the Minneapolis Heart Institute Foundation have documented that palpitations in heart valve disease can present as a racing heart for no apparent reason, sudden fluttering feelings, or the sensation of skipped beats. These can happen both at rest and during activity and can be either brief or last for an extended period. Research from Johns Hopkins Medicine shows that conditions like mitral valve prolapse are commonly linked with palpitations, especially premature ventricular contractions, where the heart's lower chambers contract earlier than they are supposed to. These rhythm issues are not just a source of discomfort, they can also be dangerous. When your heart is beating irregularly due to valve problems, blood flow becomes even more inefficient. This can result in blood pooling in certain chambers, which can potentially lead to the formation of clots that could cause a stroke. 6. Dizziness, lightheadedness, or fainting. The sixth crucial warning sign includes episodes of dizziness, lightheadedness, or fainting, especially during physical exertion. These symptoms are a clear indication that your brain is not receiving a sufficient amount of blood flow as a result of heart valve dysfunction. According to research from the Cleveland Clinic, these neurological symptoms occur because diseased heart valves are unable to maintain adequate blood pressure and circulation to your brain, particularly when your body's demand for oxygen increases during activity. When your brain is deprived of enough oxygen rich blood, it responds with these warning signals. This mechanism is especially dangerous in cases of aortic stenosis, where the narrowed valve restricts blood flow. During exercise, your muscles require more blood, but the stenotic valve creates a bottleneck that prevents your heart from effectively increasing its output. Your brain then signals its distress as blood flow becomes insufficient. These symptoms often exhibit a predictable pattern. Initially, you might only experience mild dizziness during intense physical activity. As the valve disease worsens, these episodes may happen with less and less exertion. Some patients report feeling lightheaded when they stand up too quickly. Actual fainting spells are a particularly alarming sign. When you faint because of a heart valve problem, it means your brain has been so deprived of blood flow that you have briefly lost consciousness. Swelling edema. The seventh early warning sign is swelling, medically referred to as edema, that appears particularly in your ankles, feet, or abdomen. This accumulation of fluid is an indication that your heart is not pumping blood effectively due to a problem with a valve. Research from the Mayo Clinic and the Cleveland Clinic explains that edema in heart valve disease happens when your heart is unable to circulate blood efficiently throughout your system. This leads to an increase in pressure within your veins, which in turn causes fluid to leak out of the blood vessels and into the surrounding tissues. This swelling typically begins in your lower extremities because gravity naturally causes fluid to gather in these areas. The University of Utah Healthcare notes that patients often first notice their shoes feeling tighter by the end of the day or find their rings have become difficult to take off because of swelling in their fingers. By the time this visible swelling becomes apparent, significant valve dysfunction has usually already taken place. The swelling itself has distinct features. Unlike swelling that results from an injury, cardiac edema typically affects both sides of the body in a symmetrical fashion. When you press your finger into the swollen area, it leaves an indentation that can take several seconds to fade away. This is known as pitting edema and is especially concerning when it appears in both legs. 8. Weight gain or fluid retention. The eighth warning sign is a sudden and unexplained increase in weight, particularly in your abdominal area, or a noticeable increase in fluid retention. This symptom often appears before any visible swelling and can be one of the earliest signs that valve issues are beginning to affect your body's ability to balance fluids. According to research from Harvard Medical School, the weight gain associated with heart valve problems is significantly different from typical weight fluctuations. This is not a gradual increase in weight due to dietary changes. It is a rapid accumulation of fluid that occurs over a matter of days or weeks as your heart's pumping efficiency diminishes. Medical studies have shown that patients experiencing heart failure as a secondary effect of valve disease may retain between 8 and 15 pounds of excess fluid before they even begin to notice any swelling in their legs and belly. However, cardiovascular specialists report that symptoms such as a persistent cough and shortness of breath can develop when a patient has gained as little as 5 to 7 pounds of fluid weight. The mechanism behind this is related to how your kidneys react to the reduced cardiac output. When your heart valves are not functioning correctly, your kidneys sense the decreased blood flow and activate hormonal systems that instruct your body to hold on to sodium and water in an attempt to increase the blood volume. These 8 early warning signs are not just medical facts. They are potentially life-saving alerts that your cardiovascular system requires attention. Heart valve disease impacts millions of people around the world, and early identification can be the difference between simple ongoing monitoring and the need for emergency surgery. What makes these symptoms so dangerous is how easily they can be brushed aside. That persistent fatigue must be from work stress. Those swollen ankles are probably just from standing for too long. That chest discomfort is likely just heartburn. But when these symptoms show up together or become progressively worse, they create a clear picture of a heart that is struggling against faulty valves. The good news is that modern medicine offers remarkable treatments for heart valve issues, ranging from medications to advanced surgical and minimally invasive techniques. However, the most crucial element for a successful outcome is early recognition and intervention. If you have noticed any of these warning signs, do not delay. Schedule an appointment with your healthcare provider and be sure to specifically voice your concerns about potential heart valve problems. A simple physical examination combined with basic tests like an echocardiogram can provide clear answers. Your heart works tirelessly for you every moment of every day. When it sends these signals, it is asking for your attention and care. Advocate for your health And remember that early detection and treatment can help ensure that your heart continues to serve you well for many years.